Hey Isabelle, welcome to the office. Yeah, absolutely. Thank you so much for coming in today. I appreciate your time. It's obviously very important that you come in for your annual exams. Absolutely. Well, it's very nice to meet you. I know last year you were seeing Dr. James, and this year I've come on full time, so I've taken you over as a patient. It's my pleasure to have you. If it's all right with you, I did want to go ahead and get started with a couple preliminary assessment questions. Since you are new to my patient list, I would like to make sure we have all of your preferences up to date and make sure that there's nothing missing or not any holes in your chart. Okay. So I am just going to be using my keyboard here to type into your patient portal, just taking a couple of notes. So to get started, I did just want to go ahead and confirm your pharmacy. It looks like your pharmacy is off of Riverwood Boulevard. Okay, perfect. So that is still up to date. Should you need any prescriptions, we'll make sure to send them over there. Okay, and then I also wanted to make sure nothing has changed as far as your preferences. So I had down that with Dr. James, you did prefer softer kind of pink purple lighting, so we did make sure to accommodate that today. Is that still okay for you? Are you comfortable with the lighting in the room? It's not too bright. Okay, good. Perfect. Of course, we always want to make sure that you are feeling safe. And speaking of which, I have notated that your safe word with Dr. James was pineapple, so I just want to make sure, is that a word that you would like to continue using with me, or would you like to change your safe word? Okay, so we're going to go ahead and continue to use pineapple. Okay, and then just so we are both aware, if at any point during the examination you are feeling uncomfortable or would like me to stop or anything like that, you can either say pineapple or you can say please stop or no or whatever you feel more comfortable with. But if you are too uncomfortable to ask me to stop explicitly, then you can just say pineapple and I will discontinue the examination, okay? Perfect. All right, Isabelle, well, let's proceed to a couple preliminary questions. So obviously we do ask you these every time you come in. We just want to make sure that you are safe at home. So once again, I would like to ask if you feel safe in your home environment. Okay. And is there any abuse going on in your home to yourself or anyone else? Okay. And is there any reason you would not feel safe going home today? Okay. Good. And are you still with your significant other? Still married? Congratulations on another year together. It's always a good accomplishment for anyone. And have not been pregnant or given birth since your last gynecological visit? Perfect. Are you attempting to conceive at this time? Not yet. Okay. Perfect. And obviously your last PAP was a year ago. Did you want to go ahead and include all of the standard STD screenings in this year's examination as well? Okay. Perfect. So we will go ahead and do that. I do recommend that my patients get their STD screenings done yearly, even if you've been with the same partner. There are some STDs that we refer to as ghost diseases, and those kind of can pop up years later, even if you contracted the disease way prior in your life. So even if you've been with the same partner, it is important that we continue to test, but obviously it is personal preference. So we will go ahead and add those on to your examination today. And you wanted the vaginal tests, not the blood test. Okay. So I will go ahead and make sure that we have those swabs collected. I do believe the medical assistant has all of that ready for us, but I will make sure. Perfect. And I did see that there was a specific note in here that you prefer the plastic speculums versus the metal. Okay. absolutely. No, some people are uncomfortable with the fact that the metal speculums are reusable. Obviously, they are sterilized, but it is something that, you know, goes into a very intimate part of your body, so I totally understand. So I have made sure to prepare a disposable plastic speculum for you today. Absolutely. Okay. Now, I did see that the nurse already performed your breast exam, and it doesn't look like there were any abnormalities with that. So rest assured, all of that was normal. There were no issues. She specifically notated that you had very normal textured breast tissue. There was nothing that was overtly fibrous or any cause for concern, no abnormal nipple discharge or anything like that. All of that was totally within normal limits, so there's no cause for concern there at all. She did also say that she was able to palpate your lymph nodes along your breast as well as under your axilla, and all of that was normal. Yeah. I know you said you had been sick recently, so you were slightly concerned that you felt something, but it likely was just a lymph node that was swollen due to your sickness, but it has since gone down, so that's okay. Of course, we appreciate you being proactive. It's always better to be safe and have these things checked out. Okay. Okay, so I think that is everything, unless there's anything you would like me to add to your chart that we don't already have documented. Okay, sure. So you've been experiencing a little bit of abnormal discharge. Okay. And how long has that been going on? About 2 weeks. Okay. Can you describe it to me to the best of your ability? What exactly has been going on? What does it look like? It's mostly clear. Okay. Some kind of cloudy white. Okay. Is there anything abnormal about the texture? Is it like mostly smooth and kind of wet, or is it overly mucousy? Did you notice any like large chunks or anything like that? Mostly wet, slightly mucousy, but nothing that looked like super concerning. Okay. Got it. Any pain or discomfort associated with that? No. Okay. And you are still having your regular scheduled periods. Nothing has changed. Okay. Looks like your last listed period was about 3 weeks ago. Perfect. So I will have a look when we do your vaginal exam and see if I notice anything abnormal. Is it like an excessive amount, would you say, or it's just you notice a little bit here and there? Kind of excessive. You feel like it's more than usual. Okay. And have you been experiencing any other symptoms associated with this discharge, like any itchiness or excess dryness that you don't normally notice, anything like that? Not really? Okay. And you've not tried anything over the counter? Okay. So I will go ahead and check you for a couple different things. It could be that this is just a very simple yeast infection. It could be nothing at all. Sometimes our bodies just kind of change and start increasing discharge naturally. It could be you're just at a different part of your cycle, but if this is something that is abnormal for you, I would like to go ahead and take a look at it and make sure everything's okay. Of course. Any spotting between your periods that you've noticed recently? Okay. And no chance that you could be pregnant? Not that you're aware of. Okay. Okay. Did we get a urine sample from you today? We did not. Okay. Would you be okay with us going ahead and getting one just to make sure that there is no chance of pregnancy? Of course. Yeah, absolutely. We can do that. So let me see if I have a specimen cup here, which I believe I should. I do. So I can have the nurse get all of that ready for you, and after your examination, we'll go ahead and get that taken care of. It should only take an extra couple minutes. Okay. Sounds good. All right, Isabelle, if it's all right with you, I would say we can go ahead and get started with our examination. There's nothing other than the discharge that you wanted to discuss with me, correct? Okay. All right, perfect. So let me go ahead and put this away. Perfect, okay. So I'm going to go ahead and clean my hands and put on a pair of gloves. doing an extensive vaginal exam today, I do want to go ahead and apply a pair of sterile gloves. So give me just a couple minutes here while I get these on. Okay, perfect. So now that I have my gloves on, we can go ahead and proceed with our examination. So what I would like to do first is just do a little bit of a visual inspection. So I am going to go ahead and take out my pen light very carefully as to not contaminate my other hand. I am going to be using my pen light to just have a brief overview of the area in general. So I'm going to have a look at the mons pubis area, which is kind of the top portion that grows hair, as well as in between your thighs, a little bit at the top of your stomach. I might perform some palpation, so I'll just be using my hand to push down on the bottom of your belly as well as the top of your pelvis, and then feel around kind of on the inside of your thighs. And I will of course let you know before we do anything internal. This part is just kind of an external examination, okay? Okay, perfect. So if I could have you scoot your bottom down just very slightly, maybe an inch or so, just scoot down for me. Perfect. Okay. And then I'll have you open your legs or kind of butterfly your legs so that you're giving me a little bit more exposure here. Good. Okay, perfect. So I'm going to go ahead and go in with my pen light. I can still see you. If you have any questions or you are feeling uncomfortable, you just let me know, but I'll walk you through everything that I'm doing. Okay. All right. So just having a look here at the outside, starting with your thigh, and I actually am going to start by looking at the knee and moving up into the inner thigh area. So just looking for any abnormalities of the skin, mostly looking for any abnormal breakouts or signs of cysts or any signs of infection. So obviously this is a very intimate area, and where your thighs kind of rub together, it can cause friction, and some people do get cysts in between their thighs and things like that. So just having a look to make sure there are no abnormalities with that, making sure that the skin is intact and that none of that appears overtly abnormal. Everything so far looks fine. You've not been experiencing any discomfort in this area. Okay, good. Perfect. So I'm not seeing any cause for concern. So I'm just going to palpate with my left hand only on the inside of your thigh. So you're just going to feel my hand kind of move around a little bit, and I'm just feeling for any abnormalities there, okay? Perfect. So I'm not feeling anything here. Skin all feels normal. Yeah, not as bad now that it's cold, but in the summertime it can be difficult when you're sweating and your legs are rubbing together. Absolutely. So there are several over-the-counter products that are out on the market now that you can buy, such as chafing creams or powders, things like that. I would just be careful to steer clear of anything that contains talcum powder, because obviously it is known to cause cancer, but otherwise any over-the-counter product should be fine. I wouldn't recommend putting it anywhere near your pelvic region, but in between your thighs is totally fine. Should be safe, absolutely. Unless you notice that you have a skin reaction or anything like that, it should be okay. So what I'm going to do now is use my hands to feel underneath the bottom portion of your thigh. So again, just feeling for any abnormalities there. Good. So just palpating along the skin, making sure everything feels okay. So no abnormalities with that. Okay. So what I'm going to do now is just prop up my pen light so that I can see without having to hold on to it. And I'm going to scoot a little bit closer to the exam table. And I will be using my right hand to feel the top portion of your pelvic region. So the mons pubis that I was telling you about, the area that you grow hair, I will just be feeling around kind of very gently, feeling for anything that might feel abnormal there. Okay, so just bear with me. Any pain or discomfort here? That feels normal. Okay. Hair growth also appears to be normal. There's no signs of excess irritation or any razor burn or anything like that. Ingrown hair sometimes. Yeah, that's common, especially with really any type of hair removal, especially if you're shaving. Razor bumps can lead to ingrown hairs, so I do recommend waxing to a lot of my patients if they are going to remove their hair. Obviously, hair is best, it's there for a reason, but it is a personal preference. The only reason I recommend waxing over anything else is because razor burn and irritation and stuff like that tends to be more common among a lot of my patients. So I would be very careful with hair removal creams, anything like Nair, even if it's like safer bikini or whatever claim they make. These are very sensitive areas, and I have had several patients of mine get chemical burn in these areas, so you do want to be very, very careful, okay? Yeah. So just feeling around the mons pubis area, go up a little bit further and feel kind of along the very bottom of your stomach. And just pushing down. Do you feel any pressure? Just pressure, no pain. Okay. No discomfort as I kind of palpate deeper into the abdomen, going down towards the mons pubis. There's no pain here. Okay, good. And on this side as well, no pain. Okay, good. Pressure on your bladder, yeah, okay. Well, that's good if you have to pee, because we do need that urine sample, but I do apologize. I know that can be uncomfortable. Do you find that you have any issues holding your bladder? Only if you like really, really have to go. Yeah, that's totally normal. Okay. Yep, so urgency incontinence can be normal in women of any age. I know sometimes we tend to think that that's like for the older crowd, but even younger women, whether or not you've experienced childbirth, obviously vaginal birth can increase that, but urgency incontinence really can affect anyone, especially if you have a tendency to hold your bladder longer than you should, or if you do like forceful urination where you're afraid you're not going to get to a restroom for a long time, so you force yourself to pee. That also can be detrimental to the pelvic floor. Essentially disrupts the signals to your brain of when you have to void. So if it's super urgent and you have to go right now, your pelvic floor weakens and then you're not able to hold it. So there are several exercises that you can do to help increase the strength of your pelvic floor, but it's not a cause for concern if you're completely voiding on yourself and you're having like full accidents. It might be something that we want to discuss or look into further, but if you're feeling like once a week or so you just cough or sneeze, or you're running and you just void just a little bit and you can't hold it in, that's not really anything to worry about. Yeah, absolutely. Okay, Isabel, so what I want to do now is go in a little further. So still not going inside, but I do want to have a look at your labia majora. So the labia that's on the outside of your body. So the two parts of your body that kind of go up and down, I'm going to be feeling around, and you let me know if that's painful for you at all, okay? Okay. So just using my fingers here to kind of palpate this area, making sure there's no signs of, really I'm looking for abnormal texture of the skin, if there are any bumps here or anything that can indicate something more concerning like cancer. Obviously, if I feel any bumps, we want to do further testing, but everything feels normal here, so no cause for concern so far, and also not noticing any of that extra discharge just yet, so that's a good sign. Is this painful for you at all? Okay. Good. Doing great. Okay, good. So what I would like to do now before we move on to the internal examination, because you did add on the STD screening, I'm going to go ahead and perform our first screen. So what I'm going to do is just pull this out, and essentially what this is a little sterile brush, and it's very soft bristles on it, and they're going to allow me to collect a specimen of the outside of your labia. So this is testing for any signs of infestation, such as genital lice or crabs or anything like that. So essentially, once I take this out of the package, I'll be using it to brush down your labia as well as any hair that you have in your pubic region, and it will allow me to collect the specimen, okay? Yeah. So I'm just gonna open this up. I have a couple things here. So this is the brush that I was telling you about, and there are two sides. So I have one side that is the specimen collection, and then I have one side that is the cleanser, as well as this little tool that we'll get into a little bit later. So first I'm going to go in with the cleanser, and this is basically just an antiseptic, and it's very mildly wet. I'm going to run this along the outside of your labia just like this. And it's going to clean the area of any bacteria, but it will not kill off any signs of infestation. So if you have any genital lice or crabs or anything like that, they will remain on the surface of the skin. This is just ensuring that we get a good sample and that the only thing we're collecting are any little things that might be down there, okay? Okay. It is cold though, I do apologize. So I'm going to go ahead and start. So you're going to feel me just brush down. Good. And this side. I'm going to do that 2 more times. Good. Perfect. 1 more. Perfect. Okay. So now I'm going to go in with the sample side. So this might be a little ticklish just because it is really soft, but again, you're just going to feel me brush down 3 times on both sides, okay? Good. You're doing great. Good. 1 more time. Perfect. Okay. So I am going to go ahead and place this back in the packaging, and we will send this off with your other labs. Okay. And then this little tool that I showed you earlier, it's just like a small scraper, and I'm just going to very, very gently use this to scrape along the very outside of your labia, and this is just going to ensure that if we did miss anything in the brush, we'll also send the sample down as just kind of like a secondary specimen, okay? So very slight scraping here, it won't hurt at all. Good. So we will send that all down together. And let's go ahead and proceed with our internal examination. So I'm going to start by performing some manual palpations. So essentially I'm going to be inserting 1 to 2 fingers at a time into your vaginal canal. So I'm going to be feeling for any signs of kind of vaginal polyps or any nodes that might be inflamed, any other abnormalities like inflammation or anything that feels like it shouldn't be there. So you'll just feel me feeling around. I'm going to start with the inside of your labia minora. So the labia that you have inside, you'll feel me palpate there, and then I will let you know before I proceed inside, okay? So this time I'm going to use both hands. So I'm going to kind of reference bilaterally, make sure they're feeling equal on both sides. So just going to start here. And you let me know if you're feeling uncomfortable. Just gently feeling that labia minora. If you're for any signs of abnormality, I am noting a little bit of the discharge that you talked about. Doesn't appear to be an excessive amount, but I do see a little bit of that cloudy white. Okay. So no signs of abnormality upon external palpation. So I am going to go ahead and proceed with the vaginal exam. So I'm going to start with my index finger, and you are going to feel me insert that vaginally. Okay, so I'll do that on the count of 3. Okay, 1, 2, 3. Okay, so just feeling around with my finger. To feel for any abnormalities here. Feeling along the top portion of your pelvis. And as I do this, I'm going to push down. A little bit of discomfort there. Is that painful, or you just feel pressure? Okay. Good. So I'm going to rotate to the left. Feeling this side of your vaginal wall. And fingers are facing down now, feeling the bottom region of your vaginal canal. Good. And rotating up to the right. Okay. So I'm not feeling anything abnormal here. No bumps or lumps that shouldn't be there. No obvious signs of inflammation or anything like that, which is a good sign. Okay. Perfect. Okay. So what I'm going to do now is go ahead and remove my hand. Good. Okay. So let's go ahead and proceed with the pap smear portion of the examination. So I'm going to go ahead and get my speculum. Okay, and as stated, is the plastic disposable. So we'll start with it on kind of the lowest setting, and as we proceed, I will open it further and further so that I can see into your cervix. So I'm just going to start by removing the slip here so that I can see. So you'll see that it just has a little light on it, and then I will be inserting it in parallel to your vaginal canal, of course, and then if it is uncomfortable to you at all, you just let me know, okay? Okay. So this is pre-lubricated, so you let me know if this is causing you any discomfort. So I am going to go ahead and set it here for just a second so that I can gather my swabs. Okay, so we have a couple different swabs and things that we'll be testing for, and I just want to have these ready so that I can test them one right after the other. So I'm just going to place them down on my little sterile field here. So we have a couple more than the normal because we're doing the STD screenings. So we already tested you for the external screening, which was the crabs and other signs of infestation. And then obviously now we are going to be doing the swab testing. So I will tell you what each one of these is, of course. So this one is a little funny. I know it looks kind of like a giant Q-tip. So this is your actual pap smear screening. So this is the longest and probably most uncomfortable one. So this one does go all the way down into your cervix and will be rotated accordingly. And this is what tests you for cervical cancer. So it's going to be going in, swabbing your cervix, making sure that I get a decent swab, and then we'll pull out and do the rest. So this one here, this little brush. So this one here, this little brush, so this is going to be your hepatitis screening. So this is just going to kind of scratch along the surface. It is a little bit abrasive, but it is very soft, so it shouldn't hurt you at all. So that will test you for your various hepatitis strains. And then This here is actually a multi-level swab, so this is going to test for a couple different things. This is gonorrhea, chlamydia, as well as syphilis. So that is this one here. And then these two swabs are actually just very generic. They're just testing for things like bacterial vaginosis, HPV, any other abnormal bacteria strains that you might have within your vaginal canal. Okay, perfect. Okay, so we're gonna go ahead and begin by inserting the speculum. So I am going to insert it just like this, and then you will hear clicking, and that is the speculum opening up so that I can visualize your cervix, okay? So I'm just gonna start by placing this at the base of your vaginal canal. And on the count of 3, I am going to go ahead and insert that, okay? Yep, 1, 2, 3. Now you're going to hear clicking, and that is me extending the speculum, and this will be slightly uncomfortable. It shouldn't pinch you at all. If it does cause you any pain, please do let me know, okay? Okay, so beginning to open up. Perfect. So I do have it fully extended now. No pinching sensations at all. Good. So if that does become uncomfortable, I do want you to let me know. So I am going to go in with our very first swab, and just to get it out of the way, since it is the most uncomfortable, I'll go in with our largest swab. So you're not going to feel this going in, but you will feel it once it gets to the back of your cervix, and it is quite uncomfortable, so I do apologize for that. So I am inserting it into the speculum now. Take a deep breath for me as we get to the cervix. Good. I'm just going to rotate this. Okay, doing great. Perfect. Okay, so I'm going to go ahead and remove that. Placing it on my tray here. Okay. So we're going in with our next one, which is the little brush. So this one you shouldn't really feel at all. Yeah, this one just kind of scrapes the sides. Okay, good. Okay, going in with our third swab, which is the kind of multi-test here. So we're testing multiple different things with this one, and again, you shouldn't feel it at all. You still doing okay? Okay. Just making sure we rotate that around adequately. Want to ensure that we get a good sample. Perfect. Good. So I'm going to go in with our last two. And again, these are just testing for your common bacterial vaginosis, HPV, that kind of thing. So I'll go in with the first one. Good. Doing great. Almost done. Perfect. And going in with our very last swab. I am going to do an extra sweep with this one and just make sure that we get a good swab of that excess discharge that you're having. Just make sure that we can test that and make sure that it's not anything of concern. Okay. Perfect. Okay, so so now that we have all of our swabs completed, I will go ahead and remove the speculum, okay? So I'm going to retract it just slightly. Okay. Perfect. And I will go ahead and pull it out. So on the count of 3, we're going to remove the speculum. Okay. Are you feeling okay? You did really well, absolutely. Okay, so you're all good there. Give me just a second while I turn off the light. Perfect, okay. Let's go ahead and place that here so that it can be properly disposed of. And give me just one second, I have some tissue here that I will use to just clean up some of that extra lubricant for you. Just wiping on the outside. Okay, so nothing to be concerned about there. So you might have a little bit of excess discharge following your examination, which is normal. We did just scrape your cervix, so it's normal that your body would produce a little bit of extra discharge. It might be slightly abnormal in color. Some women even experience very mild spotting, and all of that is totally normal. If it's anything that seems more than what would be considered normal or anything that is concerning to you at all, you can call me and let me know. Obviously, if you experience any severe bleeding, we would want you to go to the emergency room, but just to let you know, some women do experience a little bit of mild spotting, okay? Of course. So we are all done with the vaginal portion of the examination, so I'm going to go ahead and remove my gloves. And you can scoot back slightly on the table if you would like. Of course. Let me just clean my hands. Okay. Absolutely. How are you feeling? Feel okay? It went well. Yeah, good. I know it is very nerve-wracking. It's a very intimate examination, so I totally understand why it would make you nervous. That's completely normal. Sure. Okay, so I do have just a pad here for you. It is just a regular pad. Go ahead and open it up for you if you'd like to use this to place in your panties just in case you do have any of that extra discharge. Yeah, absolutely. So I will leave you with that, and there are extra washcloths and kind of moist towelettes in the drawer of the bedside table next to you if you would like to use those to clean up. So as far as I'm concerned, Isabelle, we are all good to go today. The last thing I would like you to do before you leave, though, is leave your urine sample. So this should be ideally filled up at least about a third of the way. There's a line here that says 40. If you could try to fill it up to the 40 ml line, that would be great. Just leave it in the little window that is in the women's bathroom, and we'll collect it for you within just a couple of minutes. It shouldn't take longer than 15 to 20 minutes for that to come back. Now, the rest of your swabs will take at least 72 hours, so I know that can be kind of nerve-wracking for you to have to wait for that long, but the results will be uploaded to your patient portal once I call you to give you the results. So whether they are good or bad, I will give you a call. That is still your preferred method of notification. Okay, perfect. So I'll go ahead and call you, give you the results for this. Should anything come back abnormal, we can discuss it. I'll have you come back in if need be, okay? All right, absolutely. Well, thank you so much for coming in today. I appreciate you. I am glad you're feeling okay. The vaginal discharge didn't look like anything that I'm overly concerned of right now. It is a little bit cloudy in color, but it's not yellow or green. There's no pinkish color or abnormal texture. It's not chunky or anything that would make me think something else is going on. If nothing else, I would maybe be leaning towards BV, but obviously the swab will come back with that and let us know. Okay. All right. Well, thank you so much for coming in. Please get home safely, and I will give you a couple minutes to get dressed here, okay? All right. Thank you.